Today, Uganda marked Haemophilia Day along with the rest of the world, hosting the main event at Mulago Paramedical School. The purpose was to raise awareness about this blood disorder, which is believed to impact more than 5,000 children in the nation. Unfortunately, only 500 of them are under the care of Mulago Hospital.
We have many, probably several cases across the country, but to date we've only been able to diagnose about 400 out of about 4,000 to 5,000 patients who we may potentially have in the country, going by the global estimates.
Dr. Kasirye Philip, a pediatrician at Mulago Hospital, stressed that this figure accounts for about 10% of the hospital is treating, citing that health workers still have a burden to deal with the disease.
We have a lot of work to do as health workers and as a community to link all people with abnormal bleeding, and especially the boy child, because hemophilia is basically a genetic condition. The affected patients are born with it, and it mainly affects the male child.
He also revealed some of the symptoms that may help one to suspect that he is suffering from hemophilia.
Usually you find in the family there's history of males bleeding for longer times when they are injured or when they are cut. That would make you suspect that there might be a bleeding disorder in that family, and hemophilia could be one such bleeding disorder. Apart from bleeding for longer times, imagine a boy has been taken for circumcision, and then what looked like a simple circumcision process ends up requiring admission because he has continued to bleed for a longer time. You need to suspect a bleeding disorder.
He advised the medical staff to pay close attention to instances of bleeding disorders and determine if it could potentially be hemophilia.
Health workers and the community at large to be keen, and once they suspect that somebody may have a bleeding disorder or bleeding tendencies, they refer them through the existing health structures to the regional referral hospitals. And
Rose Nasari, Principal, Uganda Allied Health and Management Sciences, says that most of the disorders are hereditary. Therefore, intervention need to commence early to reduce on the number of the children suffering from the disease.
It is a disease that is not well known in the community. And therefore, when this foundation comes out to talk about hemophilia, it is a good measure because we shall be able now to identify many others who have the disorder and help them. Most of these disorders are hereditary, and therefore if interventions are not made early, we are likely to have more and more cases.
Nasari adds that hemophilia is a serious problem in Uganda, with 70% having been captured, especially among the children.
It's a big problem because at the moment we can only say 7% has been captured, but it's something that we need to get. Books talk about 4,600 of these people, but only 7% of the total is under treatment.
Agnes Kisache, the Executive Secretary at Haemophilia Foundation of Uganda, has shared valuable insights on how to identify children who are affected by hemophilia with the aim of preserving their lives.
Quite a number of symptoms, but the main symptoms are the external bleeding, where you will see them bleeding from the gums. After circumcision, some of these victims bleed. Others bleed after, like ladies, during their menstrual periods, they bleed more than a week, which is very abnormal.
She also noted that the majority of the patients are taken to traditional healers, which is to be blamed for the increase of the cases in the country.
Majority of these patients have gone to traditional healers, thinking they are bewitched. But it is not anything to do with witchcraft. It is a condition we are living with, and we have not taken effort to support these patients. We've been in efforts with our government. I want to thank them that we are able to reach out to different health facilities that we work with in the different regions, but a lot needs to be done.
She adds that they have decided to work with Mulago medical students and community members to create awareness about the disease.
Today we thought if we gather the medical students the different community members around the school. They will help us disseminate information. Why do we do this awareness? We have realized that the number of patients is quite big.
It should be noted that hemophilia is caused by a mutation or change in one of the genes that provides instructions for making the clotting factor proteins needed to form a blood clot. This change or mutation can prevent the clotting protein from working properly or to be missing altogether. Julius Momuza, Church of Uganda Family TV, News at 8.